Hello everyone, welcome back to this channel. Today let's discuss some myths and facts about a commonly encountered illness, epilepsy or दौरे की बीमारी in Hindi. I will restrict this video to discussion of only myths and facts about epilepsy and not going into the details of its management because I intend to have a detailed discussion about its management along with the epileptologist of our hospital in one of the upcoming videos. Most common brain disorder affecting more than 12 crore Indians and 50 million people worldwide, epilepsy has been associated with a lot of social stigma in majority of the parts of India. Now there are a lot of myths associated with epilepsy and it's very important that people are aware of the facts so that a patient suffering from epilepsy does not miss out on the treatment opportunity and is not ill-treated by his or her near ones. Myth number 1, 2 and 3. Epilepsy is because of supernatural activities or it's a type of curse. Epilepsy is a kind of psychiatric disorder and epilepsy is infectious, hence may spread from patient to patient. Fact. Epilepsy is a disorder of the brain. It is because of some abnormal electrical activities in some parts of the brain. Hence it is not a psychiatric disorder. It is not infectious and it will not spread from patient to patient and is definitely not because of any evil spirits. Myth number 4. Epilepsy is same as seizure or fits. Fact. No, they are not the same. Epilepsy is a disorder wherein patient gets a lot of episodes of seizures or fits. But seizures can be because of so many other things like head injury, brain tumors, bleeding inside the brain, or it could be some infection of the brain, etc. Myth number 5. Seizure always means a patient vigorously shaking his hands, legs, body with uprolling of his eyeballs and biting of the tongue and the patient always loses his consciousness. Fact. No, there are about 40 different types of epilepsy and epilepsy disorders and what is described is just one of the type of seizure called as generalized tonic-clonic seizure. And there are few seizure types wherein the patient may be fully conscious. Myth number 6. Treatment of seizures once started is always lifelong. Fact. This is definitely not true for seizures of some other cause, that is non-epileptic seizures. It is not necessarily true even in case of epilepsy, as there are a lot of patients who become completely independent of medications with or without surgery. A very important thing here is in India, a lot of women suffer due to a social stigma associated with epilepsy. Please understand, epilepsy is curable and most of the modern medications are absolutely safe even during pregnancy and lactation. Myth number 7. Anti-epileptic medications have a lot of side effects and should be avoided. Fact. Most of the recent anti-epileptic medications are relatively safer compared to the older medications and are consumed by millions of individuals across the world for a very long time without any significant side effects. Myth number 8. Touch a patient who is having an active episode of seizure with iron or steel, something like a key. Fact. This has absolutely nothing to do with the seizure and it has no role in ending an active episode of seizure. Instead, try to remove some nearby hazardous things like a sharp object or a fire. Keep them away from the patient. Do not try to pull his tongue out. Do not try to put anything forcefully inside the mouth. If the patient is unconscious, be with the patient till the patient becomes conscious. And if an episode lasts more than 5 minutes, take the patient to a nearby hospital casualty. Myth number 9. Treatment of epilepsy is only possible with medications. Fact. Significant number of epilepsy and epilepsy disorders can be treated and even cured by surgical procedures. Myth number 10. Epilepsy only leads to morbidity and not mortality. That is, a patient suffering from epilepsy cannot die because of it. Fact. No, there is an entity called SUDEP, which stands for Sudden Unexpected Death in a Patient Suffering from Epilepsy. It is a sudden, non-traumatic, unexpected death which is not related to drowning. Exact mechanism is not known, but some of the hypothesized mechanisms include hypoventilation, that is less of breathing, cardiac arrhythmias, vagal attack, etc. These are some of the myths and facts associated with epilepsy. Epilepsy is so common and unfortunately so infamous that there are many more myths associated with this disease. If you want to clarify any of the myths and facts, you can ask me in the comment section below. So, I hope you liked today's video. If so, give it a thumbs up, share it with your friends and family. And for more health and wellness related videos, subscribe to this channel. Thank you for watching.